affects their immune system. Monitor for any cold or flu-like symptom for up to 21 days and wash hands frequently with soap and water. If you become seriously ill, call your healthcare provider or 0800-664-2273 for guidance. A health and wellness message from your Ministry of Health. In response to COVID-19, the government of Belize has implemented strict guidelines on persons to practice social distancing to reduce the spread and risk of getting COVID-19. Practicing social distancing is when one maintains a greater than usual distance away from another person. In public health, it is a practice to prevent sick persons from coming in close contact with healthy people. Recent studies are showing that social distance of 3 feet or more decreases the exposure of COVID-19. Before these restrictions, a person with COVID-19 could infect 2.5 persons in 5 days, 406 persons in 30 days. When you put into practice measures to reduce the exposure activities by half of that one infected person, in 5 days you would possibly only infect 1.25, 30 days, 15 persons. Reduce the exposure of that infected person by 75%, in 5 days you infect 0.625, in 30 days 2.5 persons. Remember, the virus does not move on its own, people move it. The more space between you and others, the harder it is for the virus to spread. A health and wellness message from your Ministry of Health. If you have been directly exposed to the new coronavirus or have a history of travel in infected populated areas, it is recommended that you self-quarantine. Identify a room to be used to self-quarantine and limit contact with healthy persons. Keep away from older persons and persons who have medical conditions that affects their immune system. Monitor for any cold or flu-like symptom for up to 21 days and wash hands frequently with soap and water. If you become seriously ill, call your healthcare provider or 0800-664-2273 for guidance. A health and wellness message from your Ministry of Health. In response to COVID-19, the government of Belize has implemented strict guidelines on persons to practice social distancing to reduce the spread and risk of getting COVID-19. Practicing social distancing is when one maintains a greater than usual distance away from another person. In public health, it is a practice to prevent sick persons from coming in close contact with healthy people. Recent studies are showing that social distance of 3 feet or more decreases the exposure of COVID-19. Before these restrictions, a person with COVID-19 could infect 2.5 persons in 5 days, 406 persons in 30 days. When you put into practice measures to reduce the exposure activities by half of that one infected person, in 5 days you would possibly only infect 1.25, 30 days, 15 persons. Reduce the exposure of that infected person by 75%, in 5 days you infect 0.625, in 30 days 2.5 persons. Remember, the virus does not move on its own, people move it. The more space between you and others, the harder it is for the virus to spread. A health and wellness message from your Ministry of Health. If you have been directly exposed to the new coronavirus or have a history of travel in infected populated areas, it is recommended that you self-quarantine. Identify a room to be used to self-quarantine and limit contact with healthy persons. Keep away from older persons and persons who have medical conditions that affects their immune system. Monitor for any cold or flu-like symptom for up to 21 days and wash hands frequently with soap and water. If you become seriously ill, call your healthcare provider or 0800-664-2273 for guidance. A health and wellness message from your Ministry of Health. In response to COVID-19, the government of Belize has implemented strict guidelines on persons to practice social distancing to reduce the spread and risk of getting COVID-19. Practicing social distancing is when one maintains a greater than usual distance away from another person. In public health, it is a practice to prevent sick persons from coming in close contact with healthy people. Recent studies are showing that social distance of 3 feet or more decreases the exposure of COVID-19. Before these restrictions, a person with COVID-19 could infect 2.5 persons in 5 days, 406 persons in 30 days. When you put into practice measures to reduce the exposure activities by half of that one infected person in 5 days. In response to COVID-19, the government of Belize has implemented strict guidelines on persons to practice social distancing to reduce the spread and risk of getting COVID-19. Practicing social distancing is when one maintains a greater than usual distance away from another person. In public health, it is a practice away from another person. In public health, it is a practice to prevent sick persons from coming in close contact with healthy people. Recent studies are showing that social distance of 3 feet or more decreases the exposure of COVID-19. Before these restrictions, a person with COVID-19 could infect 2.5 persons in 5 days, 406 persons in 30 days. When you put into practice measures to reduce the exposure activities by half of that one infected person, in 5 days you would possibly only infect 1.25, 30 days, 15 persons. Reduce the exposure of that infected person by 75%, in 5 days you infect 0.625, in 30 days 2.5 persons. Remember, the virus does not move on its own, people move it. The more space between you and others, the harder it is for the virus to spread. A health and wellness message from your Ministry of Health. If you have been directly exposed to the new coronavirus or have a history of travel in infected populated areas, it is recommended that you self-quarantine. Identify a room to be used to self-quarantine and limit contact with healthy persons. Keep away from older persons and persons who have medical conditions that affects their immune system. Monitor for any cold or flu-like symptom for up to 21 days and wash hands frequently with soap and water. If you become seriously ill, call your healthcare provider or 0800-664-2273 for guidance. A health and wellness message from your Ministry of Health. In response to COVID-19, the government of oxygen or ventilator support. Be caring and show support for your elderly loved one during this time. A health and wellness message from your Ministry of Health.
During stressful times, what children need most is you, a safe, secure relationship. The actions you take will greatly affect how they cope with the stress of the outbreak. Here are tips you can follow to help reassure children. Stay calm and be kind. It's understandable we will experience frustration and anxiety. However, discuss your own questions and worries about COVID-19 when your child is not around, and resist the urge to outwardly show frustration in the presence of children. Lastly, limit your child's exposure to media about COVID-19. Don't allow rumors to dominate your conversations. Focus on up-to-date scientific information from official sources such as the Ministry of Health's Facebook page or the World Health Organization, WHO. Keep daily routines as consistent as possible for your child. A familiar structure will reassure and help prevent anxiety. For more information, visit our website.
As the COVID-19 pandemic continues to affect the lives of all Belizeans, Channel 5 is keeping you informed of all the latest developments. For an insightful look at the week's events across the country, tune in to Uncovering COVID-19, a Channel 5 special every Friday at 8 p.m. Join host William Neal and his guest panelists as they provide in-depth analysis on the impact that COVID-19 is having on all of us from a health, economic, and legal point of view. Don't miss this informative and significant television program, Uncovering the COVID-19 Pandemic, every Friday night at 8, only on Channel 5.
COVID-19 is an infectious disease caused by a new coronavirus introduced to humans for the first time. It is spread from person to person, mainly through the droplets produced when an infected person speaks, coughs, or sneezes. These droplets can land in the mouths or noses of people who are nearby. These droplets are too heavy to travel far in the air. They only travel approximately 1 meter and quickly settle on surfaces. This is the reason person-to-person spread is happening mainly between close contacts. The exact time that the virus can survive on surfaces is not yet known, so it is wise to clean surfaces regularly, particularly in the vicinity of people infected with COVID-19. Hands touch many surfaces, which can be contaminated with the virus. You should therefore avoid touching your eyes, nose or mouth, since contaminated hands can transfer the virus from its surface to yourself. When coughing or sneezing, cover your mouth and nose with the bend of your elbow, or use a disposable tissue. If a tissue is used, discard it immediately into a closed bin. The most effective way to prevent the spread of the new coronavirus.
If you have been directly exposed to the new coronavirus or have a history of travel in infected populated areas, it is recommended that you self-quarantine. Identify a room to be used to self-quarantine and limit contact with healthy persons. Keep away from older persons and persons who have medical conditions that affects their immune system. Monitor for any cold or flu-like symptom for up to 21 days and wash hands frequently with soap and water. If you become seriously ill, call your healthcare provider or 0800-664-2273 for guidance. A health and wellness message from your Ministry of Health. In response to COVID-19, the government of Belize has implemented strict guidelines on persons to practice social distancing to reduce the spread and risk of getting COVID-19. Practicing social distancing is when one maintains a greater than usual distance away from another person. In public health, it is a practice to prevent sick persons from coming in close contact with healthy people. Recent studies are showing that social distance of 3 feet or more decreases the exposure of COVID-19. Before these restrictions, a person with COVID-19 could infect 2.5 persons in 5 days, 406 persons in 30 days. When you put into practice measures to reduce the exposure activities by half of that one infected person, in 5 days you would possibly only infect 1.25. 30 days, 15 persons. Reduce the exposure of that infected person by 75%. In 5 days, you infect 0.625. In 30 days, 2.5 persons. Remember, the virus does not move on its own. People move it. The more space between you and others, the harder it is for the virus to spread. A health and wellness message from your Ministry of Health. If you have been directly exposed to the new coronavirus or have a history of travel in infected populated areas, it is recommended that you self-quarantine. Identify a room to be...
Can we give it a shot now? Okay. Good afternoon again. I wasn't sure that we were not hearing what we were discussing, but it gives me a second go at what I was going to say. I do have to say that I will switch over to Espanol to explain some of the information after the first 15-20 minutes. We had said last week that we were going to be having some questions and discussions for the Spanish-speaking audience. Unfortunately, I can't do it in any other language other than English and Spanish. So what I had started off by saying is that I am here to give certain elements of good news for sure, is that we have one recovered patient so far. We can only say recovered after you have 2 negative samples, so we only have one person that meets that definition, and we're anticipating that throughout this week in the testing processes that continue, that we'll be able to have and be able to tell you of recovery cases as we move along. If you follow the little infographic that we publish after 3 p.m. every day, we had started that little portion and it says recovered 0, so that will be updated today because the cutoff time is at 3 p.m. I have to also remind, we did this last week, Tuesday, Wednesday. Sometimes the tests are run early in the morning and that's why you get that at the cutoff time at 3 p.m. But sometimes if the samples go in at 1, 2, that is not going to be reflected in that daily report. It's going to come on the following day. So that's where you had a little bit of a delay between Saturday, Sunday, and we had that notion last week, Tuesday, Wednesday. In terms of patients hospitalized, one of the patients went home on Friday, so we only have one patient hospitalized currently, and that's in the Western Head region. And in terms of quarantine, you will recall that we had a full list of people who are in quarantine in the Corozal district. We only have 2 persons there. One of those, both of them, hopefully, if the patient that is there is positive is recovered, he would be able to go home, and we have 1 person that's just completing the day's quarantine that we had anticipated from everybody. The other patients are faring fairly good. In terms of the recovery process and how we'll go about announcing it, we're just going to basically be placing that in the infographic as we move along every day. Patients who have been dealing with this situation, you will note we are into our 5th week of having announced our first case. They have asked for respect for their privacy in terms of their recovery process, because just like we are also going through different mental stresses aside from all the social conditions that we have to learn to live with, patients are also going through different processes in terms of their mental situation. So some patients have asked if they can just be, if we can just stop labeling them, if you will understand, and that we just put whenever they have recovered that they are informed, and then that is placed up on the infographic, and that's how we are going to go about doing it. So the 15 patients that are at home are basically with no specific medication, and they are recovering pretty well. In terms of where we are with our testing, we have done close to 170 tests over the last 6 days. Some days you have a bigger batch going in. I do have to stress that we are, like we had said, we are anticipating that the swabs that we use for doing the testing and the enzymes that are needed for the testing, because it's not just the actual test that you need, but you need extraction enzymes, you need purification enzymes. Those should be arriving tomorrow. We did follow up on the Cayman Island offer. We spoke with people who are directly linked to the Cayman Islands lab in the Cayman Islands, and they indicated that their enzymes for the testing kits that they have, they're on a backlog order for that will last between 6 to 8 weeks. So even if we are to procure those kits, our backlog will perhaps be longer than 6 to 8 weeks. So we're going for now to keep on with the actual PCR platform testing kits and hoping that we are getting all those enzymes tomorrow. We are anticipating also that some of the equipment that we had paid for, PPEs and all those other ventilators, should be arriving tomorrow. Even the supplies from PAHO that were supposed to have arrived, the reactions are here. We got 2,500 reactions for doing testing, but the other elements have not arrived. The COMISCA documents that we had signed off 1 month ago on March 24th are also pending for arrival, but it's important that we stress where we are in terms of that. So I guess we'll get right into the questions because that's where we are with the testing. We are reviewing with the team how we are going to expand our testing, because one of the reasons why you also have less people being swabbed is people are having less and less flu-like symptoms, or at least they are not showing up in the health facility. We had said also that our traditional flu season usually goes from October to March. We are in the month of April, so we believe that it's following the pattern that we would have expected with epic curves then. So the numbers are significantly low. As a matter of fact, yesterday we went for a period of 4 to 6 hours where nobody called the 0800 number, and I think we need to stress that. And the calls that keep coming in, most of this morning, I checked before I came here, have to do with the social elements that are now attached to COVID-19. People asking, when are we going to go back to being normal? When can I go back to work? The food situation, social situations that we are well aware of, but that's the 0800 MOH Care is not able to address all of your concerns in that regard, and they are being channeled. So we are going to go back and review where it is that we are going to be testing, because we have tested all those patients who are hospitalized that have influenza-like illnesses and severe acute respiratory illnesses. So we are considering we may open it up more to have people having some other condition, and maybe Thursday, Friday do what we would call a sweep of secondary or even tertiary contacts that are symptomatic of the initial cases as we move along. We are the last 4 cases that we reported was last week Monday, but they had been swabbed on the Saturday and Sunday before we actually announced the results. So I think it's important that we say that. For an outbreak to be officially declared over, you would need to be 28 days without a single case. So that's the actual definition in terms of where we're epidemiologically speaking. Understand that we never transitioned into a stage 2 of our response. We have basically remained at stage 1, even though we took stage 3 measures, and we did that progressively. Can't shy away from the fact that just this morning, and I'm saying that because our neighbor up north, so that you can get an idea of how long this can be, and we have to go about being careful in how the advice we are able to give as we move along. The government of Mexico this morning declared that they are now in a stage 3 situation, and they are not expected to peak at the current curve that they are having until May 23rd. That's more than a month from today. So that will give you an idea of where they are going with their number of cases. In case people are already asking when will that border, for example, be open, I can tell you they are not expecting to peak until May 23rd, so that we get an idea of how difficult it is to do predictions in that regard. We are working with SIB. We have a tool now that kind of maps out a curve and different scenarios, and we should be able to share that for the public in a way that people can understand, and also understand that that is what guides policy decision from our end. That's what guides recommendations that we make. We don't come up with these things just like that in an isolated form. So I'll get into the questions, and then, as I said, for the people who speak Spanish, we'll do a portion of what the information in Spanish. It says, are recovering patients receiving high vitamin treatment? Not necessarily. They have really, for the most part, been without any medication. Any updates of the case in Corozal? How are they doing? I already have mentioned the patient who was hospitalized in Corozal has gone home. We have, well, the cases are, we have to wait for their time period for them to be swabbed again to see if they have started that recovery process. And if the patient who is quarantined turns out to be negative, then he'll be able to come out of that quarantine and go home, still taking necessary precautions. We are telling people to take those precautions up to day 30 after they were initially diagnosed. Why would Worldometer report 2 cases healed in Belize? We don't know where that data came from. Our official data, have I just vocalized it for you, but in the report you're going to get at 3 p.m. or after 3 p.m. it will say only 1 recovered case, because that's what we have up until now. If there's any recovered cases later on in the day, that would be reflected in the report tomorrow. But we need to stress that because, as I said, the cutoff time is 3 p.m. If the results come out before 3 p.m., they're reflected. If they come after 3 p.m., then they're not going to be reflected in the daily report. Should I be overly anxious about disinfecting my shoes every time I go out and come back in? Well, that's a tricky situation. This is particularly recommended in environments such as a hospital setting where you have a potential much higher viral load and shedding, if you will, so that healthcare workers, for example, are going to be asked to not use the same shoes once they reach home, not even the same clothes. So they should shower or change in the facility, their hospital facility, before they get into their car and go home. And once they get home, they should change upon arrival at the doorstep. But I don't know that would apply for the general public. We are not at that stage yet in that regard. What is the case recovery definition? Are we following the CDC guidelines with PCR tests? Yes, we do PCR tests. That still remains the gold standard for testing for COVID-19. The case recovery definition, in other jurisdictions, they have said test at day 14, and then if that is negative, test at day 15. We are changing that a little because we are noticing that our patients at day 14 are still turning out positive. And when you read the literature, and again, we are all learning as we move along, some literature is saying even at day 27, we have had some people say up to day 34, people are still positive. So we are routinely doing swabbing at day 14. If that is positive, we don't swab you again until day 21. If that's negative, then we run a second sample so that we are able to determine whether you have recovered. If you are still positive at day 21, we will make an assessment and perhaps swab you 7 days later. And that's simply because, unless patients are, of course, depending on the condition, we may change that, but that's where we are going for right now. Will persons recovered still be expected to remain quarantined? Well, you're not necessarily having viral shedding. What we will still recommend for people who are recovered is that they still wear a mask, they still do their own processes, and that's just as an abundance of caution and noticing what other countries are reporting. That's what you see, that when people say that they have come back to be positive again, seems to be not a reinfection, but the fact that the virus never really went away. So we will still ask that people take necessary precautions even though you have 2 negative samples. Will countrywide random testing be carried out countrywide to identify positive and that are asymptomatic? We are reviewing that case definition. We are, of course, have said we are not in a position to test everybody in the country. What we basically look for is frontline workers. We have been looking for healthcare workers, for example, who have flu-like symptoms. They have been swabbed. They have all been negative. Even the ones that have been exposed have turned out to be negative. Some of them have been swabbed twice and they have still remained negative, so they have gradually incorporated back into their work. For example, the staff that was exposed in the Cayo and Belmopan areas, most of those staff have gotten their 2 swab results. They are negative, they are symptomatic, they have gone back to their routine activities. Is it true that Belize will be purchasing kits from Cayman Islands? If so, why buy them now when we didn't initially want them, when they were being offered for free? 2 things there. They were not the same kits. I think we had clarified that. This is the 3rd time we are saying that. They are not the same kits, and even if we decide to buy the Cayman Island ones, we have to understand that we will still need to buy separate reagents which the Cayman Islands doesn't have. We have to go and procure them, and it's going to take more than 6 weeks for those reagents to get here. As I said, Cayman Islands has ordered the reagents needed for their testing kits, and they have a backlog of 6 to 8 weeks. So that's very important for us, and that was communicated to the Oversight Committee yesterday, the discussion we had with Cayman Islands on the weekend, so that we are sure of what decisions we are taking in that regard. Can you say after how many days the patient recovered the first time and then the second time? I don't have that data with me. All I know is that he has recovered, or the patient has recovered. Then, if you had said we would start doing wider testing, where are the numbers of testing infographic not reflecting that? Well, I have said that we were going to go out and routinely be looking for all respiratory illnesses and doing random testing and testing healthcare workers. That has happened. We did test everybody hospitalized that had influenza-like illness, that was having severe acute respiratory symptoms, healthcare workers that were ill. But as I have said, the numbers in terms of flu symptoms have decreased significantly. So according to our epic curve, when will the number of cases peak? Well, we don't have any right now. As one of the epidemiologists in the team reminded me, we are perhaps not even having a curve because it remained there. It hasn't gone anywhere. If we are able to contain this, assuming we have no cases popping up over the next 7 to 10 days, then it will have been a wave 1, if you will, which means once you start opening up, or whenever you get exposed to people from outside of Belize, if nobody else shows up, can you have a second wave? Yes, and you can have multiple waves down the road and for the next 12, 18 months. Was any follow-up done with the 2 US citizens who said they got COVID from Belize? I wasn't aware of that. I was aware of people who were potentially positive, came to Belize and then went back, but we did not get that information confirmed. If after 28 days has passed without a new case, will you advise the borders to open? That's a tricky situation because I just explained, for example, what's happening in Mexico. So we might not have a case, but if they're just going at a very rapid pace, escalating in their curve, it is not going to be sensible for us to make that recommendation. If the US is just going to their curve and they might not be peaking till July, then you will understand that it's not going to make that much sense, even if you have an open airport or open border, because you are going to have to be selective with who will be allowed to come in. You will recall going back to January, we first said people coming from China can't come, and then you added countries, South Korea, Taiwan. That might be the way we open up. You can say, okay, people from X country can come in, and again, you open it up gradually, the same way we kind of lock down. I think that's the same process we're going to follow. Yeah, shortage of testing components. Swabs, I think we are good. Enzymes are scheduled to arrive tomorrow. As I said, the kit itself, we have 2,500 reactions, but it's not, there's many other elements that are used in actual testing. Those are expected tomorrow. Any additional measures to be implemented by MOH on recovered patients? No, we continue to follow them. We assume that once they developed any sign or symptom down the road, we swab them again. We may have to make a decision as an epidemiological team whether we swab them or whether we take blood samples for whenever there's antibody testing to see whether they developed antibodies and keep those samples stored as we move along. Mapping and tracing exercises concluded for all clusters. With no new infection reported. Remember, today is 14 days for the initial lockdown for the Cayo area. Doesn't seem to be any active cluster happening there. We are not seeing symptomatic patients, at least. Corozal as well, we are not seeing those symptomatic cases. San Pedro as well. Well, San Pedro has been now into day 30, I think, since we started with measures for them, or 4 weeks at least. And Belize City, well, that's the one we are following closely because that's where the bigger cluster came, and that's the more recent one reported last week of Monday. Dr. Etienne this morning indicated that PAHO is dispatching 1.5 million more tests through the region, followed by 3 million next week. Are any of those tests coming to Belize? We already got 2,500 reactions from that, and PAHO has committed to delivering 11,500 more reactions. So it's a total of 14,000 that will be coming to Belize in that regard. And yes, ramping up of testing. As I said, we are going to determine who we are going to test, because if you are not having anybody having symptoms, then who else do you need to go and test? So we are considering even perhaps moving to people who just have fever as an option, or people who have gastrointestinal infections, diarrhea, vomiting. That's as we ramp up the testing. But if people are not having any respiratory symptom, then that's part of the reason why the numbers are down in terms of overall testing. Does the Ministry of Health provide any documentation to those persons who are requested to be on the self-quarantine or isolation because they are possible contact person? Yeah, remember when we changed and did the mandatory quarantine, that particular something up north, people were asked to sign that quarantine paper even when they had moved and they had been moving around. Like people who were ill, cancer patients for example, who were allowed to go home, they had to sign that quarantine paper for everybody in that regard. And how can an employer verify an employee's information that they are required to quarantine and not come to work? Well, whoever gave them that should have been able to give you a paper, because if you are being under quarantine for specific to COVID-19 because you have been exposed, then there should be a doctor who can and should fill out the Social Security form for the employee. There's one thing I think we need to stress. We started seeing some people who have not had any exposure to COVID-19 start to show up with Social Security forms that says that they're under quarantine for COVID-19. We have to be very careful about that, because we will have to go through a verification process of those sick leave forms. And the last question in English before I switch to Spanish. It says, are there any discrepancies between people showing COVID-19 symptoms and then testing negative? In other words, how sure are we that the swabs are being done correctly and achieving the proper results? The trick situation here is, recall that most of our patients, except the 2 that were hospitalized, were virtually asymptomatic. We actually picked them up as part of the mapping exercise, not because they were ill. That's a vast amount of patients we picked up. So, and that's why we do 2 negative samples as well. And we are not doing it if I swab you today and you're negative, I swab you again tomorrow. We are allowing a space of 2 to 3 days before we swab you again, which is why I'm only able to confirm that 1 patient has recovered. More hopefully will recover in the rest of the week. So I'll go on into Spanish. Solo para dar un informe, las preguntas las pueden hacer en español y las vamos a tratar de contestar en el tiempo real. Solo para informar que tenemos un paciente recuperado de COVID-19. Ese paciente, para que te consideres un paciente recuperado, tienes que tener 2 pruebas negativas. No tiene que ser en días sucesivos, pero sí tienen que ser 2 pruebas negativas para que consideremos que te has recuperado de COVID-19. Esperamos que en esta semana tengamos más pacientes recuperados, pero no les puedo decir que eso haya pasado. Los pacientes que están en su segunda prueba los vamos a confirmar en el transcurso de la semana. De los pacientes que tenemos en cuarentena en el área de Corozal, ya solo quedan 2, un paciente que es positivo y un paciente que está esperando el tiempo que le dijimos a todo el mundo que tiene que estar en cuarentena. Ese pacientes probablemente para el fin de semana que viene ya no van a estar en cuarentena, ya no vamos a tener en ninguna persona en la cuarentena obligatoria que habíamos enunciado. Solo tenemos un paciente hospitalizado. Si ustedes están siguiendo, teníamos 2, un paciente en Corozal y un paciente en el Hospital Regional de Belmopan, que inicialmente estaba en Carl Huchner. Ese paciente sigue hospitalizado en Belmopan. El paciente de Corozal se mandó a su casa el pasado viernes, lo cual quiere decir que de los 16 pacientes que tenemos, 15 se considera que están activos, 1 recuperado, y pues ya sabemos que 2 pacientes lamentablemente fallecieron. De los 15 pacientes que están activos, solo 1 está en el hospital, los demás 14 pacientes se están recuperando en casa. Si ustedes igual rutinariamente a las 3 de la tarde ponemos una gráfica que nos dice cuántas pruebas hemos hecho, cuántas pruebas son negativas, cuántas pruebas son positivas. Hay un segmento ahí que habla de las personas bajo investigación. Eso simplemente indica cuáles pacientes están pendientes de que le corramos la prueba o cuáles pacientes todavía están en cuarentena esperando que le tomemos muestra nueva para poder indicar si están en efecto negativos. También nos han preguntado mucho por qué en los últimos 3-4 días parecen que cada vez estamos haciendo menos pruebas. Aquí hay dos cosas. Una, principalmente, es que no estamos viendo pacientes con síntomas respiratorios en el sistema de salud. A pesar de que tengamos búsqueda activa, los pacientes no están llegando, no se están reportando. Y habíamos mencionado que tradicionalmente la temporada de gripe generalmente va del mes de octubre a finales de marzo, por lo que nosotros anticipamos que para el mes de abril iban a haber menos pacientes accesando los servicios. Y eso es lo que ha pasado. De hecho, las líneas telefónicas, el número 0800 que tenemos, la gente no nos está hablando porque tiene síntomas de gripe, nos está hablando porque tiene, ya sabemos los problemas que la gente ya está empezando a tener, cuestiones mentales, cuestiones de dónde va a conseguir comida, cuestiones sociales. Entonces no es tanto el problema de gripe lo que parece ser el principal problema aquí. En esta semana estamos revisando cómo podemos hacer testeo en más pruebas, a pesar de que no tengamos pacientes con síntomas. Así que eso es lo que vamos a empezar a revisar en esta semana. Habíamos dicho que no teníamos los hisopos para hacer la prueba. Esos están pendientes de llegar, esperamos que lleguen mañana. Y también estamos pendientes de recibir las enzimas que se utilizan para extraer y purificar el virus. Porque no solo es la prueba rápida que usamos, sino que hay un proceso de extracción, purificación del virus. Esos reactivos no están del todo en el país. Tenemos para correr pruebas esta semana, esperamos que lleguen el día de mañana para poder seguir corriendo las pruebas rutinarias. Recordar que el último caso reportado fue la semana pasada, lunes. Esos pacientes se les tomó muestra sábado, domingo de la semana pasada, que fue sábado de gloria, domingo de resurrección, por lo que llevamos 7-8 días sin caso reportado. Para que nosotros podamos decir que no vamos que la epidemia actual ya se rompió o ya se controló o ya se eliminó, tienen que pasar 28 días sin un caso activo. Entonces eso es importante porque si revisamos lo que está pasando en el país vecino del norte, en México, en Estados Unidos, nos damos cuenta que México, por ejemplo, dice, el día de hoy anuncia que está en la fase 3 de su respuesta, y ellos no esperan que sus casos disminuyan, que inclusive esperan que eso vaya en incremento gradual hasta el día 23 de mayo, que es cuando esperan llegar al pico en cuanto al número de casos. Es importante porque de repente la gente nos pregunta cuándo van a abrir la frontera, cuándo se van a abrir los aeropuertos, ese tipo de situaciones. No es algo que va a ser tan fácil tomar en cuenta. Si pensamos que en México, por ejemplo, hasta el 23 de mayo ellos no están pensando en una reducción de casos, entonces no podemos pensar que esa frontera al norte se va a abrir en forma rutinaria si es un país que tiene casos activos y que cada vez van creciendo. Lo mismo pasa con Estados Unidos. Entonces vamos a contestar las preguntas que nos pongan en español y ya terminaré con la nota en inglés, pero la intención era darles información en español porque de repente nos han estado preguntando mucho que tenemos una comunidad y entendemos que es una comunidad bastante grande que solo habla español, aunque yo sé que el idioma oficial es el inglés. ¿Qué pasó con el hombre que dijeron que estaba en Carolina, que era un posible caso, que era de Corozal? Ese paciente salió negativo. De hecho, el paciente, hasta donde entiendo, falleció el día de ayer. Ese paciente tuvo un accidente automovilístico y tenía una lesión medular. Pero ese paciente falleció ayer. Los pacientes recuperados van a ser monitoreados por si llegan a dar positivo otra vez como en otros países. Sí, lo contestamos en inglés. De hecho, nosotros estamos haciendo rutinariamente ahora, no estamos dando el seguimiento al día 14, lo estamos haciendo al día 21 y nos esperamos si sales negativo, nos esperamos 2 o 3 días antes de volverte a hacer prueba. Precisamente porque estamos viendo lo que pasa en otros países, que algunos lo clasifican como una reinfección, cuando más bien parece que el paciente nunca en realidad se recuperó de COVID-19. Entonces, por eso ustedes entenderán que por eso extendimos la cuarentena, que inicialmente teníamos 14 días y ahora decimos que son 21 días. Va el Ministerio de Salud a hacer pruebas de anticuerpos del COVID-19 para saber quiénes con todos contrajeron el virus, así como hizo los Estados Unidos. También lo contesté parcialmente en inglés. Es algo que lo hemos considerado. No tenemos pruebas de anticuerpo y antígeno en el país. De hecho, el estándar de oro para hacer diagnóstico de COVID-19 es pruebas de PCR, que es lo que estamos haciendo en el país. Esto lo podemos empezar a hacer inclusive tomando quizá muestras sanguíneas en los pacientes que ya se recuperaron para ver si en efecto hicieron anticuerpos contra el COVID-19, porque si ustedes leen la literatura, se habla y se dice que hay algunos pacientes que no hacen inmunidad, o sea que tuvieron COVID-19 y no hacen anticuerpos. Es muy importante que entendamos eso, pero no lo estamos haciendo de momento. ¿Qué parámetros hay para abrir la economía si ya no se reportan casos nuevos en la próxima semana? ¿O cuándo sería viable? Bueno, para que consideres que la epidemia, los casos que tenemos, porque el epidemiólogo del Ministerio de Salud nos recordó que no podemos decir que tenemos una curva porque la curva ya no avanzó más allá del caso 18, ahí se quedó pues. Entonces, para que puedas decir que ya no tenemos casos activos, tendrías que pasar 28 días sin detección de un caso. Es muy importante decirlo. No significa que 28 días te vas a tomar en reabrir o una reapertura de todo. Nos han preguntado de la escuela, no sé cuándo va a empezar la escuela, si es que va a empezar o si se va a perder todo el ciclo escolar. Es una decisión que se revisa cada semana. Lo que nosotros estamos pensando es que más allá de la economía, pues cómo se va a ir reabriendo todo en el mismo, quizá usando los mismos parámetros que usamos para cerrar la economía. Si ustedes se acordarán cómo fuimos cerrando gradualmente en enero, febrero, marzo, hasta llegar al punto donde estamos, yo creo que es el mismo parámetro que vamos a usar para empezar a reabrir. Por ejemplo, hoy se cumplen 14 días, las 2 semanas iniciales del cierre casi completo de todo para el área del Cayo, y el viernes es para todo el país. Si no encontramos ningún caso de aquí al viernes, entonces algunas cosas se puedan empezar a abrir con la cautela que se debe de tomar, entendiendo que nada va a regresar a ser normal, que el distanciamiento social, el lavado de manos, de repente el uso de mascarillas, ese tipo de cosas ya no van a ser iguales y donde vayamos, eso va a seguir persistiendo. ¿Qué tratamiento usa el Ministerio de Salud para los pacientes que se recuperen? Pues la gran mayoría de los pacientes han estado asintomáticos. Nosotros solo los encontramos por el mapeo inicial que hicimos, así que no es que el paciente requiera tratamiento. De hecho, no hay un tratamiento específico, es un virus. Ustedes de repente habrán escuchado del uso de la cloroquina, la hidroxicloroquina como tratamiento potencial. La nueva evidencia que salió este fin de semana es que parece que no hay ningún beneficio palpable con el uso de cloroquina. Entonces es algo que empezamos a revisar porque todos estamos aprendiendo, es un nuevo virus y vamos viendo lo que otros países están haciendo. ¿Tenemos solo para esta semana los test kits y esperamos conseguir más esta semana? No, tenemos los reactivos para hacer las pruebas. Algunas de las enzimas para las pruebas deben de llegar mañana, eso es lo que yo dije. ¿Sería posible que aunque Corozal y Ranchovac no tengan casos nuevos, siempre le hagan pruebas más frecuentes, igual como lo tuvo el Distrito de Cayo y Ciudad de Belice? Sí. De hecho, quizá la gráfica, como la debemos de manejar, y creo que lo hemos mencionado en inglés, es quizá hacerlo en forma proporcional también, porque uno de repente revisa los números para el Distrito de Belice, parece que son muchos, y tú revisas lo de Toledo y dices, bueno, parece que son muy poquitos, pero acordémonos que no es la misma población. Entonces, si tú lo haces en forma proporcional, eso te da un mayor semblante de en realidad qué tipo de pruebas estás haciendo en cada distrito. ¿Se están haciendo pruebas suficientes para aceptar que no hay ningún caso más? Bueno, no tenemos ningún paciente que se está reportando con gripe. no los estamos identificando, la gente no está viniendo. El número telefónico que tenemos de repente del martes de la semana pasada, hoy tiene una semana, al día de hoy, la mayor parte de lo que la gente pregunta en el número de teléfono es cosas más ajenas a la cuestión de salud. Entonces, búsqueda activa, hemos estado buscando todos los casos que se han presentado en el sistema de salud con problemas respiratorios, se les ha tomado muestra desde la semana pasada y no hemos tenido ningún caso positivo hasta ahora. Porque conozco a alguien que tenía síntomas y el doctor solo chequeó y le dijo que la prueba no era necesaria. Bueno, de repente serán los síntomas. No sé si esto fue en el sector público o en el sector privado, pero en el sector público nosotros sí estamos buscando hacer un muestreo significativo con los pacientes que tengan síntomas, aunque sean leves. En lo que resta de la semana, jueves, viernes, sábado, quizá vamos a hacer lo que se llama un rastreo activo, que es buscar pacientes, contactos no solo primarios, secundarios o terciarios de los casos iniciales en la ciudad de Belice, por ejemplo, para ver si hay algún agrupamiento ahí que esté en particular un poco activo, para empezar a dar un mejor panorama de cómo estamos. Pero hasta ahora, como yo les decía, no tenemos casos que son relativamente muy infecciosos o muy sintomáticos, por lo menos, como para que estén hospitalizados. Y los pacientes que han estado hospitalizados les hemos tomado la muestra. Bueno, aquí es donde vamos a terminar. Las preguntas en español me parece que eran todas. Antes de que me hablen en inglés, es recordarles a todo el mundo que tienen que estar buscando información veraz, que sea el Ministerio de Salud o la página oficial del gobierno quien dé la información. De repente surgen muchas notas en las páginas de los periódicos, de las noticias de Belice, que no se han verificado. Entonces, si ustedes quieren verificar la información, tienen que esperar a que salga de una fuente oficial, porque de repente el fin de semana hablaron de 2 pacientes recuperados, hablaron de el paciente que me preguntaron por ahí de Carl Husha, que era un caso sospechoso, el paciente estaba negativo, y en mi punto de vista personal no era caso sospechoso de COVID-19, pero busquen las fuentes oficiales, no hay que caer en pánico, no hay que caer en información que sea falsa. Recordarles que aunque regresemos un poquito a lo que antes hacíamos o consideramos normal, entender que las normas en cuanto al distanciamiento social, el uso de mascarillas, el lavarse las manos, si tienes algún síntoma de gripe no debes de ir a trabajar, entender que cualquier persona que te encuentres en la calle lo debes de tratar como si fuera un paciente potencialmente positivo, eso no va a cambiar. Mientras no tengamos tratamiento ni vacuna, y eso no va a pasar en los próximos 12, 18 meses, no podemos considerar que vamos a regresar a nuestra vida normal. Entonces es lo que tengo que decirles en español, que es un resumen de lo que dijimos en inglés, y hay que estar al pendientes de la información. So closing off, folks, as we go back to English, we'll be providing information as it comes along. I really would want to continue to stress to all to wait for the official information that is going to come from us in a timely manner. I know that Sunday we got caught up in this particular case of the situation at Carl Husha. In my point of view, that patient seemed to be having conditions related to the spinal lesion that he had. And that's a personal viewpoint as an internist. But then I did not realize that there was a lot of situations brewing up on social media because of what had been posted prior. We cannot also be jumping to everything that pops up on social media, because we have to be very responsible in the information I'm going to be able to give you. So we didn't post anything until Sunday, because once the sample was collected, it has to go through the process of being tested, and once we get a result, we put it out for everybody to see, review, as soon as we get it. So please, let's continue to wait for official sources of information. Even if you have recovered cases, I mean, that's a positive, yes, but we have to wait for the official source and the official channels, and by all rights, the patient is the first one that needs to be informed. It cannot be that everybody is going to start socializing whatever they think is happening when you are not informing the patient through the due process. That's one. And two, as we determine what other testing mechanism we're going to take in terms of who we're going to be testing as we move along. We'll also be providing that and sharing that with the different regional management teams. Understand that as we consider, or in the back of our minds, how we are going to go back reopening if we don't have any case in the week, whatever that means, the issues that we currently have will remain. You have to assume that anybody you meet on the street is a COVID-19 patient. Social distancing will be there, 6 feet if possible. If you are ill, you should not be out on the street. Hand washing is going to remain forever. Avoid touching your face is going to remain because we don't have a vaccine, we don't have treatment. So this is at least for the next 18 months. So if that's going to be for the next 18 months, then that becomes the new norm. So thank you very much again for listening to our information, and we'll be providing updates in due time. Thank you.